Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Good morning, everyone. It's Mohamed Saad again, and we are here with Dr. Jesse Roman, who gave us fantastic talk about aging lung, and we're gonna summarize his talk in probably a minute or two. So go ahead, Dr. Roman.
Thank you so much, Dr. Saad, and thank you for having me. When we talk today about the aging lung, there's a lot of interest in aging. There are about $6 to $7 billion invested every year by industry and government and others trying to tackle the aging process. The United States today accounts for about 16 to 17% of people who are 65 years or older. There are other countries like Japan that are at 26%. And this population is going to continue to grow. We know that this population has a higher susceptibility for injury, for cancer, and other problems that have tremendous implications for our healthcare system and for their lives and their families' lives. And so today we talked about the aging lung, trying to compartmentalize this complex process. And there were 2 or 3 concepts that we made important today. Number one, that the aging process is very complex, but the scientists are compartmentalizing each of the components of the aging process to be able to study them in relevant models: senescence, proteostasis, matrix abnormalities, mitochondrial dysfunction. All of those things can be tested and evaluated in more simple systems to be able to identify interventions for patients. The lung in particular has all of these changes: oxidant stress, inflammation, mitochondrial dysfunction, stem cell potential is reduced. But importantly, in my area of interest, is the matrix of the lung is very altered. There's less elastin, there's more collagen, there's more matrix-degrading enzymes. And these result in abnormal mechanics. You see it when you test patients with pulmonary function tests. And the aging lung is also more susceptible to injury. Go to your wards, go to the intensive care unit. You will see people who are 55, 65 years of age. So the question is, how do we handle this? And what's important is, how do we begin to identify how those anomalies happen? And that's why we spoke about oxidative stress being only one of many potential factors that can induce it, and one of these factors that can be affected by environmental exposures. Again, environmental exposures like smoking, pollution, poor diet, prematurity. All of those can affect the lung in ways that we cannot detect as a 65 or 70-year-old walking around, but already makes our lung abnormal and our cells behave inappropriately to injury, causing disrepair and moving into a profibrotic phenotype. Now, the good news is there's a lot of agents that are being explored to test this. People are talking about antioxidants or talking about anti-integrin receptor agents or matrix binding receptors. Senolytics are being tested in their clinical trials happening these days, looking at the safety, tolerability, and effectiveness of senolytics that identify senescent cells and pull them out of the group to work. So I think in summary, our aging lung has a lot of abnormalities. It reflects also what's happening to many of the organs of your body, that there are specific changes that can be tackled with individual interventions, that those interventions are being tested in clinical trials. They're not available today, but there's always things we can do. Avoid pollution, avoid smoking, exercise, immunizations, changing behavior until these drugs and quicker interventions are available to us.